Stage 3, which is the key really for most of us, is the actual analysis of the lips. So you actually need to make an official part of your consultation that I'm now analyzing your lips. Many people don't. You go straight to injecting. And that, that's okay. But if you want to do a top level consultation, there's an official moment where you start to analyze their lips. And that's when they start to understand that there's more to aesthetics than just big lips, because you can talk a lot about the detail. This is the kind of thing we cover in depth in Lip Masters, my online course. But we'll cover the overall value, the top level view of it from here.
Just to say, I think if someone said to me, I'm going to analyze your lips, I'd be like, exciting. Like, I think it's good to sort of to note that you are of that level of expertise where there's a stage and you go through the process and it's got to be done. I think that's a really good value add.
Now, some people don't feel that way. Some people feel on the back foot. They're like, oh no, now I'm going to be criticized. So one good tip to have before you start any facial analysis is start with a compliment, and it should be real compliment. Don't make up stuff. But I always say something nice before you start with little things that can be improved.
Okay. So tell us about that process.
Okay, so I want to first of all acknowledge what they've told me. So if they've told me about their aesthetics goals, often they're onto something. Most patients have picked up a ratio without any training, because this is actually built into our DNA. Like, we know what healthy looks like. And most people, beauty is healthy. It's the same thing, essentially, until you're in the realm of fashion and culture. So it can turn into something else. But for most of us, there's a reason they know they're going to be more beautiful, and they've tried to articulate it. And at this point, I'll often justify what they've said. So if they've said, I want more lips more like this celebrity, and I've noticed that celebrity has symmetrical lips and she has asymmetrical lips, or a top lip bigger than the bottom, or the other way around, I will then say, what you're picking up is that the lip is a different ratio, which means if we increase the ratio so that you're moving closer to the picture that you showed me, you're actually moving closer to the scientific definition of beauty. And so even though we may not get 100% there, just moving closer is going to do that for you. So I'm trying to pick out from what they've said and bounce back the science so that they can feel it's justified.
Nice.
So I would, that's the simplest version of it. You just simply reflect, because most people are right on some levels, not everyone. And then you can layer on the extra stuff that you learn. Now, there's all sorts of things you can pick up about how to describe this beauty, and it is a much longer chunk of work. But your proportion, detail, even the contrast, the ratios, the curvatures, all of these things you should aim to over time articulate to patients depending on what they've got, so that they get a conscious idea of what beauty is, and you're the one who gave it to them. So you're immediately the expert now, and it takes away this battle over how much for a mil. When they can see that you're actually designing an aesthetically beautiful result based on something that's to do with training, you're going to be far ahead of those who are just distributing filler. So products, you've really got to know your products. It's a little bit like the techniques, to be honest. Like, you will get a different opinion on different products from different people. What I've discovered is really listen to those opinions and then test it and get to know yourself. I don't think you can know a product based on what it looks like when the patient is in front of you, because I think they all look pretty similar. I can't tell if I've used Voleft or Volbella on the day or Juvenum Ultra 3 because there's swelling involved. So you immediately get it. Basically, the main thing you see is swelling. What you want to do is take the advice from people who've used products for years and try and figure out how they're using different products if you haven't got loads of experience. And then the best thing, of course, but this is the one that takes time, is to get to know products over a period of time. I think a year of using one product as your primary lip filler will really set in stone how that product behaves, because you're going to see them at follow-ups. And then you'll just establish, are they losing definition with that product that's different to a different product? So I have collated all of that in various things I put out about what I believe about certain products, but I do recommend practitioners get to know products and then choose them accordingly. What I believe is the biggest variable is around volume versus definition. I think there's a tension where you can have a product that's very good at producing volume, but it tends to be less good at creating definition. And if you get something that's very good at creating definition, you might disappoint people who want volume. So I would try, as a broad brushstroke, to just understand your products in those two dimensions, and that will help you choose accordingly.
Super useful. And that does sort of suggest that the dual technique might be good.
Yeah.
But it's more expensive. Yeah.
You don't do it you never get to do that unless you're doing good consultation, because it just sounds like you're increasing the price for no reason.
But for someone like me, I'm 39, I think. And if I were to come and get my lips done for the first time now, I'd be really worried I'm going to get some gross duck lips. So if you consulted me well and found out that was a problem and then said, well, this is how we're going to do it, I think I would be willing to spend that extra money just to avoid that fate.
Oh, plenty of people have got a way bigger budget than they think they've got when they understand the real dynamics going on. And, not many people figure that out. They just do what the first thing the patient asks. So this is where great consultation changes budget. So after the analysis, you're then in the realm of choosing your technique. So this is the bit, a lot of people have skipped everything up to that and they're just going straight for the technique. Really, your technique should be specifically built around everything we've just learned from our patient. So we're trying to assemble the ideal technique. And that means you've got to know lots of techniques. You have got to get them all. If someone comes in and asks for Russian lips, you need to know what the benefit of that technique is and how you can actually use it for specific cases to get a result. What I definitely should avoid is trying to use the same technique on everyone, because it just doesn't work. And you'll find this out rapidly that, if you try and use the Russian lip technique on someone who's got very, very thin lips, you're going to be disappointed. There just isn't the room to create that with that technique. So you need to build it up and do it a different way. But the expert is seeing all the techniques it's like a box full of tools, and you're selecting the right tool for the job. And that also applies to the products that you use and the instruments that go on the end of your needle. So are you using a needle, a cannula, what size, what length of needle? All of that is building around avoiding the risks and maximizing the aesthetic goal, which is then going to maximize the social cycle, the psychosocial impact on your patient, which is really what this is all about. So first step is you need to know your techniques and what the benefits of them are. Now, I have a different experience to the next injector. If I talk to one of my colleagues who've been injecting with similar length of time, they will have a different opinion on the pros and cons of each technique. And although I can give that, it's also important that you try these out yourself and get to know them. You've got to make a decision and instinct, because you're the one at the end of the day holding the needle. So know your technique and then start to understand how do each of these techniques have benefits for different problems, for definition, for eversion of a lip, for projection of a lip, for volume. Pure volume might be the thing, for details that you can create, for the angles that you might want to create. So once you understand how all those techniques work and you've got the complete history of the patient, you can pick a selection of techniques or components of different techniques and design that treatment design with your patient. And literally, if when you're really good at this, you explain why each step is going to match them perfectly. And it's dazzling for patients. I almost think we shouldn't be putting this out. It's so good. But anyway, that's what you should do. So now we need to think about the technique that we're comparing. Now, once again, remember, I'm comparing like for like in as many different ways as I can keep things consistent. Both entry points are on the same. That's in the pink part of the lip. This is very important because I think there's a technique which is sometimes thrown into the mix which confuses the horizontal versus vertical. So I'm picturing entering on the pink side of the lip in both instances at exactly the same point, because if you change the entry point, everything changes. There is a brutal technique where people used to go through the white lip multiple times, right through where the artery is. And I think this is behind why a lot of people really don't like vertical injections. But it's actually not the way many injectors are injecting these days. I know, having confirmed this with Julie Horn, that her technique, as most of the ones I've seen in recent times, are through the pink part of the lip, which does change things completely in my mind. So when I picture a vertical injection, this is the vision in my head. We're entering the pink lip. We're skirting superficially. It is a superficial injection. We're avoiding the deeper part of the lip envelope because we're trying to rotate the lip up slightly for most of those injections. And we're progressively moving away from the most likely position of the artery. If you consider the most likely position is just behind orbicularis oris, we would start out parallel with it, and the needle, as it goes deeper in, should be moving slightly further away. Now, horizontal injections are the same, but we'd be running right over and adjacent to the artery. And we'd be staying in that plane the entire journey of the needle. So there's more time spent close to the needle. And if you're superficial, you should still be away from it, but it's technically more likely, with an anomalous type of anatomy, to clip a little loop of that artery. That's what I'm picturing in my mind. Now, this is the issue. With normal variation in a young client, I cannot see how a horizontal injection would be less likely to catch the artery than a vertical injection, because most of the time we'd be away from it. So what's the psychology of the older patient? Now, remember, everyone is unique, and I can't speak for everyone, but there are tendencies to go with certain age groups, have certain psychological approaches to their aging, and it's more common in general to be in a more defensive mindset. So these are people seeking certainty, they want restoration, they may be a little bit afraid if you talk about adding volume and making things more beautiful. They just want to go back to who they were. They're not trying to change themselves. And they're often very afraid of looking done.
drawing negative attention through, some of my clients would describe it as mutton dressed as lamb. They don't want to be seen by their friends to be trying to be younger. They just want to stay in alignment with their identity. Now, what often happens with this is they start to request the wrong treatment out of fear because they don't want their lips done. And what this means is that you end up with isolated treatments, because if you're trying to treat upper lip lines, for example, and you don't treat the body of the lip, you get that Homer Simpson look eventually. Joe! And this unfortunately happens to people who don't want to be overtreated, is that they end up treating just the lines, and this then changes the overall shape of their face, and they look treated in a different way. So we must avoid the Homer Simpson mouth, and the way to do that is with a good consultation that makes sure that your patient is educated and informed on what the aesthetics are made up of and how your injection technique will protect them from looking like a trout pout, that will also make them look younger, which is obviously what they're looking for.
So another very popular question was, what do you do with male lips without feminizing? What's your approach to it sounds more like restoration, but it could be augmentation, but without making a feminine lip?
So whenever I'm doing men, if I want to keep them looking masculine, the only difference that I do is I try and kind of almost make it look a little more square, which sounds odd, but the lower lip especially, whenever you're doing the pillows, I try and keep my pillows closer for whenever I'm doing a feminine lip. And if I want to masculinize, I'm not going to have heavy pillows. First of all, they're going to be a little flatter and they'll be a little wider. So again, it's just kind of a little wider than a feminine lip. And I guess if you want to kind of, picture that, I'm going to come up close here. And basically right here, this is ideally where if I was going to use a needle, I'd make my entrance point a little closer. And if I was going to do the entrance point with a masculine lip, I'd go a little wider. And if I did that, if I went a little wider with, let's say, a feminine client, I've yet to have anyone complain about it, but I don't personally like it. I find it makes the lip a little bit more masculine because it kind of squares it off. Mm-hmm. More recently now, I'm doing almost all my lips with cannulas these days, and it works great. The only thing that I try and do whenever I'm looking for a more masculine lip is hydration. I don't really change much. It's just more hydration. I'm definitely not arching any Cupid's bow. I just want to keep it natural, keep it hydrated, and that's about it. If there is a guy who comes in and they're looking for something more than that, then clearly it's because they want to have more feminine, more dramatic lips. But for a more masculine lip, keep it, natural, and you're just trying to rehydrate the lip more than anything.
Yeah, I totally agree. Basically, less is more. I do think there's something I sometimes think about, or at least explain how the lip should fit in with the chin. So you can see it on mine, it's straight at the bottom and straight at the top, and then those angles, they sometimes meet. It's what you're saying about it being wider. So it's because your chin is wider, and they kind of work better together. And it's also why, if you do it to a female, what you're picking up with your aesthetic eye is it no longer fits the face if those angles are now, if you follow the philtrum down, they're pointing somewhere over here instead of to the angle of the chin. It actually all fits really, really nicely together.